Welcome everyone to a new episode. In this episode, we have a special guest, Ashley, who is a pharmacist and a doctoral researcher. Ashley, please introduce yourself.
Hi, so my name is Ashley Cid. I am a recent graduate of the University of Waterloo School of Pharmacy. I received my Bachelor of Science there and my Doctor of Pharmacy, and I'm also currently completing my PhD in pharmacy there. I'm also a pharmacist by trade, and I work in community pharmacy, and I also work as a researcher at the Ontario Pharmacy Association.
Awesome. So, what inspired you to pursue a career in pharmacy?
Yeah, so I kind of had a bit of an interesting start to it where I out of high school I wanted to join kind of almost immediately. So out of high school I kind of already knew that I wanted to pursue pharmacy, and so Waterloo has a early entrance program called the CAP program, and so I was really motivated to start learning more about pharmacy because of that. So I started volunteering in pharmacies. And what I really liked about pharmacy was that you were able to provide a lot of influential patient care without having to do some of the gross things like touching patients and things, and teeth with dentists and all those sorts of very on hands type clinical care. I saw that you could still provide patient care and effective patient care in pharmacy without having to do some of the nitty gritty things that I thought I wouldn't be able to do if I was another healthcare practitioner. So I always knew I wanted to be some sort of healthcare practitioner, but I chose pharmacy just because of the fact that it can still be quite influential without having to do a lot of the nitty gritty work.
Fantastic. And Waterloo is actually famous for its co-op program. So, what co-op experiences did you have in your pharmacy program?
So in pharmacy there, they allow you to do three co-op programs. My first co-op, I chose just a generic community pharmacy co-op just to kind of gain more experience and learn some of the things I was learning in my first year of school. I went back to the Shoppers Drug Mart that I had been volunteering and working at before going to pharmacy school. And there you kind of implement a lot of the things you learn from school about how to talk to patients, how to provide over the counter care counseling, and as well as counseling about new prescription medications. So there you were able to fill medications, but at that stage you weren't able to sign off just yet on them. So I was doing a lot more patient counseling than signing off on prescriptions. And then for my second and third, I went to the same co-op. So I joined a research team with Dr. Kelly Grindrad at the University of Waterloo School of Pharmacy. And there she was doing a lot of research related to online learning platforms, specifically for pharmacy professionals. So when I was doing my co-op there, she launched something called the Pharmacy 5 and 5 online learning program. And so I was writing a lot of the modules for that program, as well as putting those modules into literature reviews and publishing them for her. And then on top of doing research there, she also worked in a family health team type clinic. So there we were working with a lot of vulnerable patients and doing more of a clinical family health team type conversation with them versus more inside of a pharmacy, which was interesting to see.
Awesome. So, what influenced you to pursue research in the field of pharmacy, like from the beginning?
Um, I'd say it was that co-op with Kelly. So I realized that I really liked the research end of things versus the actual clinical side, providing actual patient care. And the reason why I saw that was because when you're in the pharmacy, you see problems occurring, and you're not necessarily able to change policies and things by working in the pharmacy, but you can provide more influence on policy and change by doing research and working on the sides that of policy that work with the government themselves. So those are the sides that provide a lot of actionable change that you're able to see more so when you work with your patients. So that's why I chose research, was being able to provide more actionable change.
Yeah. Speaking about change, how does your research field bring innovation to the field of pharmacy?
Yeah, so in my field, I focus more on optimizing solutions for the opioid crisis. I have done other research in other areas, but I'd say my PhD mostly focuses on that. And so the innovation part of it is trying to look at the root of what exactly is driving the opioid crisis, not just the illicit side of it, but also the prescription side, and trying to determine ways that we can help mitigate those. So, for example, recently publishing a economic evaluation of naloxone in Canada to understand, is it actually cost effective for the government across Canada to publicly fund naloxone? And we indeed saw that it was. And so that might provide innovation and actual change to provide a publicly funded naloxone across Canada, especially the intranasal format, which is only currently publicly funded in Ontario, Quebec, and the Northwest Territories.
Awesome. And you mentioned that you're currently working with the Ontario Pharmacists Association as well. So can you please let us know, like, what does your role involve, and basically, how are you, like, basically inspiring the change in the field of pharmacy through your role?
Yeah, so at the Ontario Pharmacists Association, I work in the professional affairs team. So that team, they specifically work to provide solutions for a lot of the advocacy asks that their members have. So one of them being the minor ailments prescribing. So that team was crucial in having conversations with the government to try to introduce minor ailment prescribing and look at, well, how exactly would that work in if it were to become something that came to light, and it actually did come to light. So they work a lot with trying to introduce new policies and working with Ministry of Health to increase scope of practice. My job specifically is new, so they typically weren't doing too much research before that, and so now to kind of supplement their advocacy asks to the Ministry of Health, they're using research as the background for that, and so my specific I guess job title is called pharmacist research and practice. And so I work a lot of on the behind scenes trying to determine what are the different pathways we should be approaching, what are some new programs that we could introduce into pharmacy to help improve patient care.
Amazing. And I kind of have like two questions. So, where do you see the field of pharmacy in the next 5 years? Like, how will it grow, especially in the province of Ontario? And where do you see yourself as a pharmacist and as a PhD graduate in the next 5 years?
Mhm. So I see the field of pharmacy growing quite rapidly. In fact, in the past year, it grew quite a bit, especially with the minor ailment prescribing that I mentioned and the recent expansion of additional minor ailments that we're able to prescribe on top of the original 13. Just as of yesterday, we were able to properly implement the prescribing for the RSV and, sorry, not the RSV, the Tamiflu and the I forget the other one, but Tamiflu for sure. And then as well, I see it in the future being able to go more and more. So a lot of things like maybe even pharmacy care clinics, for example. So we see that with Shoppers Drug Mart right now, where they're trying to implement a lot of kind of almost like walking clinic type style clinics. I see it being more patient-centered care and even introducing more types of specialty chronic medication counseling. So not just focusing on diabetes meds checks, but maybe other forms of chronic diseases like chronic pain, for example. So I see it being different than it was definitely 10 years ago when I started in pharmacy, where we didn't have a lot of these clinical things that you could do in a pharmacy. Mostly it was focused on dispensing. And so I see that becoming even more progressive in the next 5 years. In terms of where I'm going to be, it's hard to say because research and academia changes so much. So I'm hoping that I can stay on with OPA. And if a faculty position happens to open up, then I'm open for that too, to working as a professor in a school of pharmacy.
Awesome. Thank you for sharing your insights about your story to pharmacy and about the field of pharmacy. Thank you for being a guest speaker.
Thank you.